Hey, what's going on, my knee warriors? Tony Maritato here. So once again, you guys force us to be better clinicians. Karen posted this great question in the group, and I thought it was worth coming on, sharing my screen, and sharing a little bit of knowledge. So I'm actually going to share my computer screen. Hopefully nothing weird pops up. So Karen says, I keep seeing mention, let me see if I can zoom in here for you guys. I keep seeing mention that their knee hurts a lot due to cold, rainy weather. So is it something new that we have to deal with at some point? Does arthritis disappear after a total knee replacement, or is it still there? I think probably the biggest challenge here is the fact that what we are calling arthritis isn't a universal term. My guess is your understanding of the word arthritis is different than my understanding, which is different than the surgeon's understanding. And even within that, so, still there, been 7 months, doctor told me also. Jacqueline had a great share that, let me see if I can find it here. So she took this from this bonesmart.org, arthritis being a degenerative disease. I'm gonna dispute that in just a minute. That destroys cartilage. So I would say osteoarthritis is a degenerative condition that destroys joint cartilage. Osteoarthritis is a condition that destroys joint cartilage. It is not resident in the bone. You see the rest, right? So let's just talk about language for a second. We know words have power. We know words can influence outcomes. You've heard the story, if a person is raised in an environment where they're just constantly badgered and told that they're going to amount to nothing and they're worthless and they're terrible, they tend to live up to that expectation. And so within the medical community, I think most of the people in this group have probably been familiar with the term placebo, but nocebo is a term less used, and nocebo essentially refers to language or interventions that actually increase a negative outcome. So if I tell you, your knee is so bad, it is bone on bone, we would call that in the profession nocebo language that plants the picture in your head of bone on bone, which must be painful. I mean, I don't know, what does bone on bone even feel like? If you really think and examine, we have no perspective. Even me as a physical therapist, I cannot tell you what living bone on living bone feels like because I've never felt it. But certainly the perception is it must feel horrible. But what does that even mean? These are terminologies that are being thrown around by surgeons and by physical therapists and other healthcare providers because it doesn't really mean anything to the provider, but it's massively impactful on the patient. And we're making a concerted effort to stop using this kind of language. And if you hear a provider, a healthcare provider, say something that kind of fosters this sense of fear in you, I think you should bring it up. I think you should say something about it, and you should ask, for more details. So I like this article. I've referenced this article in multiple public talks. Arthritis is very common, but it's not well understood. This is from the Arthritis Foundation. So it's a well, respected, reputable source. Actually, arthritis, the term arthritis, it's not a single disease. It's an informal way of referring to joint pain and joint disease. Because there are diseases. There's rheumatoid arthritis, which is an autoimmune disease. There's other things. Arthritis, like here, there are more than 100 different types of arthritis and related conditions. So when somebody tells you you have arthritis, they're basically saying, you know what? You have a stiff and painful joint, and maybe you have some degenerative changes that are going on there or other stuff. That's it. don't read between the lines. Don't take more out of it. If they want to give you a definitive diagnosis, a real diagnosis, then let them do it. But a diagnosis of arthritis, you have arthritis in that joint, or you will get arthritis in the future. That is just like saying, well, you're going to have joint pain at some point. I've got joint pain, like everybody has joint pain. That's a normal part of life. So it's not a disease. I want you to understand that there are diseases within the umbrella of arthritis. But most of the clients, certainly I know you guys are going to watch it. There's some of you who have osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis is a completely different animal than osteoarthritis. If I fall playing with my kids outside and I damage my cartilage a little bit, there's a degenerative change that has happened to that cartilage, so that's a normal function of life. Now, certainly there are pro-inflammatory conditions like type 2 diabetes and cardiovascular disease, and these conditions raise inflammatory markers that can be measured within the blood. And we tend to believe that the more systemic inflammation your body has, which it's like a fever, right? It's your body's immune system fighting something, we don't know what, then there's reason to believe that that immune response may be a component in what's causing the damage within the joint. Now, there's some schools of thought that, well, I'm not going to get into any more than I've already said. But the idea is, I just want you to know, arthritis is not a disease. Arthritis is an umbrella term, covers over 100 different kinds of conditions. And you just need to be educated to know, okay, so I've got stiff joints and some pain. I knew that before I went to the doctor, right? So let's get into the question about weather. And when somebody's asking questions, if you're not familiar with this, pubmed.gov is a great resource. Yes, it's super clinical and it's above my head most of the time, but it gives you some general peer-reviewed, the best chance you have at clinical information that's not going to be selling you a product, that's not going to be somebody's opinion. Certainly there are biases in here like everything, but so here's an article I found, The Influence of Weather Conditions on Joint Pain in Older People with Osteoarthritis. There's also articles about rheumatoid arthritis, which is a different condition. And so, the study examines 3-day average weather conditions, and changes in weather conditions influence joint pain in older people with osteoarthritis in 6 European countries. There was about 810 participants, so it's not a 100,000 participant study. Take it at face value. Don't put too much stock in it, but it gives you a suggestion. It says the association between pain and daily average weather conditions suggests that a causal relationship exists between joint pain and weather variables. So association does not always equal causation. Right now outside, it's cloudy, right? Every time it rains, it's cloudy. But every time it's cloudy, it doesn't always rain. So I can't create that kind of causation every single time. Just because it's cloudy doesn't mean it's going to rain. Just because the weather changes doesn't mean you're going to have joint pain. The data suggests that maybe there is a causal relationship between weather changes and joint pain, but the associations between day-to-day changes, so yes for 3-day, but single day does not confirm causation. Knowledge about the relationship between joint pain and OA, osteoarthritis, and weather may help individuals with osteoarthritis, physicians and therapists do a better job understanding and managing fluctuations in pain. And here's the big problem. So to answer the question Karen posted, Karen, I think if you asked the surgeon, he would say there's no arthritis left in that joint. We cut away all the arthritis. They would basically say they cut away all the damaged parts of the joint and replaced it with a prosthetic implant. So technically there is no arthritic damage within the joint. That being said, what is your knee made of? Your knee is not strictly made of bone and cartilage. There's ligaments, there's soft tissue like muscles, there's veins and arteries and lymphatic vessels, there's fascia, which is a connective tissue. There are many, many, many more components to your knee than just the hardware that was installed. So I would say, yes, a person can still have pain associated with the joint that was replaced. You know better than anyone, your knee can still hurt even after your knee replacement, as evidenced by the length of rehab and the frustration that everybody with a knee replacement goes through. So that being said, the other component and the example that I always share is if you've ever had a cold, a flu, a virus, right? You know that you're getting sick because you feel that soreness, that muscle ache, that back pain. It feels very orthopedic in nature. But when you go 24 hours into it, you're like, oh, I've got a fever, I've got a runny nose, sore throat, I'm sick. But the orthopedic pain you were feeling in your muscles, that achiness, that malaise, that throbbing, if you didn't realize you had a cold, you would think, and it could easily be misinterpreted as osteoarthritis. The difference is it gets better 24, 48, 72 hours later. But I just want you to understand that there are lots of things that will produce the sensation of pain. It's not just the arthritis, the degenerative change that's happened inside the joint. It's not just a single variable most of the time. A lot of times it's a combination. It's, poor sleep, poor nutrition, increased stress, weather changes, history of trauma to the tissue. I've got a left knee that I just beat up over the years doing lots of crazy stuff. Most of the time it feels just fine, but on occasion, once a year, it wants to remind me, hey, I'm still here. You took advantage of me when you could. So are you, Karen, going to experience pain in the joint with changes in weather? No, probably not. People who have always experienced pain in joints with changes in weather probably will continue. It might just not be in the joint that was replaced. But hopefully the take-home message from this rant is that arthritis is not a disease. Arthritis is not a life sentence of pain. Arthritis is a generalized term that covers over 100 different varieties and conditions that you just want to translate in your mind. When somebody says, hey, I've got arthritis, you say, hey, I've got a stiff joint and maybe some pain somewhere also. High five. We've been active. Because I promise people who are inactive have just as much arthritis and joint damage as those who were active. So maybe in the next session, we can talk about activity, bust some old wives' tales and some myths. No, running is not bad for your knees. No, exercise doesn't destroy your joints. Yes, when you have joint pain, one of the best options is to exercise, to do it in a correct, effective manner that doesn't make your pain worse, but improves your body chemistry. All right, I'm going to end it. I hope that this was helpful. I hope this cleared up some things, because I'm the first one to say, when we talk about healthcare providers who say stupid things, my hand is up. I say stupid things every day. And after I say it, almost as it's coming out of my mouth, I'm like, oh, why did I just say that to this person? Now this person is going to carry in their mind the image that I painted, which probably wasn't the right image, because to me, it's like, yeah, who cares? Everybody has arthritis. I have arthritis in probably every joint of my body. It doesn't mean anything. But to the person sitting in front of me who's already scared, already in pain, already nervous about their future, to them, I just gave them a death sentence. I mean, it's really a shame, the words we use and the ignorance on the healthcare provider's part. So keep us honest. Keep the questions coming. I'll catch you guys in the next video. Best wishes.